At Cleveland Clinic, we understand that joint pain can be debilitating. It prevents you from enjoying and engaging in daily activities. While you may struggle to move, you may also experience instability, muscle loss, weight gain, and fatigue. Scheduling an appointment with one of our orthopedic surgeons at a Cleveland Clinic location is convenient and easy using our website, mobile app, or call center. Your first consultation with your surgeon will include a detailed medical history and physical exam. We will discuss your pain, limitations in movement, and any treatments you have had. Once surgery is determined to be the best option for you, your surgeon will discuss what to expect over the course of your surgery and recovery. That discussion will help you have an understanding of how your state-of-the-art surgery will be performed and the important details of how your joint will be changed and improved. At Cleveland Clinic, we practice the latest techniques for joint replacement and will discuss with you the most appropriate surgical plan based on your individual needs, as well as any specific temporary post-operative precautions. Prior to surgery, you will undergo pre-admission testing within Cleveland Clinic. This will be separate from your visit with your surgeon. This testing consists of a detailed medical history, a physical exam, lab work, and EKG. If you have a pre-existing condition that requires special attention, a separate medical specialist will be added to the pre-testing team and they will review your results. If necessary, any modifications will be made to your surgical plan. Although joint replacement surgery is safe, there are some risks, and we want to make sure we take every precaution to lower and hopefully prevent them. The most common risks associated with surgery are related to anesthesia, infection, and blood clots. The type of anesthesia used during your surgery will be determined by your anesthesiologist. The surgery being performed and your medical health will determine what is most appropriate. Commonly, a spinal anesthetic or general anesthesia will be used. A spinal anesthetic allows for better pain control, earlier mobilization, and speedier recovery after surgery. Infection is rare after surgery, but it can happen. Preparation before surgery has an important role in prevention. Optimizing your diet and nutrition prior to surgery promotes healing while reducing the risk of complications such as infections or poor wound healing. Here are some important diet reminders. Stay hydrated. Increase your protein intake. Avoid constipation with appropriate fiber intake and eat foods with iron, vitamin C, and calcium. Poorly controlled diabetes is a risk factor for wound healing and infection with a joint replacement. In preparation for surgery, you will need to have an appropriate hemoglobin A1C level prior to proceeding with surgery. It is important to be honest with your healthcare providers about your medical history and lifestyle. This information helps determine if you are at an increased risk for complications after surgery. We're here to help prepare you and help you recover from surgery as quickly and as safely as possible. Smoking, or the use of nicotine products such as vaping and chewing tobacco, increases the risk of medical complications and slows recovery. Smoking also increases the risk of infection and blood clots after surgery and decreases bone and incision healing. If you use nicotine, you must stop at least 4 to 6 weeks before surgery to lower these risks. Dental hygiene plays an important role in infection prevention. Any necessary dental work should be performed 6 weeks prior to your surgery and should be delayed 6 weeks after your surgery if it is not urgent. Discuss with your surgeon regarding any dental conditions or infections you may have prior to your joint replacement surgery. To lower your risk of infection, we ask that you shower the night before surgery. You will use chlorhexidine gluconate or CHG antiseptic wipes after showering and again the next morning. Please follow the instructions provided. A blood clot is a potential complication after a total hip or knee replacement. A blood clot from your leg can travel to your lungs and cause serious complications. Symptoms of a blood clot may include pain and/or redness in your calf or leg that is not related to your incision, increased swelling in your thigh, calf, ankle, or foot that does not decrease when you raise your leg, and increased skin temperature at the surgical site. Warning signs of a blood clot include shortness of breath and chest pain, especially with breathing. If you develop any of these symptoms, please go to an emergency room or call 911 immediately. Blood clot prevention is best accomplished with early and often mobilization. Even while in bed, do ankle pumps to help keep the blood moving. Every patient will be assessed to determine what blood thinning medication they will start taking after surgery or what they will continue taking. Conditioning your body prior to undergoing joint surgery is an important step towards improving your strength and contributes to a successful recovery. We will give you simple exercises to help you maintain activity. While making preparations for your health before surgery, it is also important to prepare your home for your return so you can have a smooth transition to healing. Remove loose rugs and clutter so you can move around safely. Widen furniture paths to accommodate a walker, crutches, or a cane. Your doctor's office will provide a prescription for this item so you can have it prior to surgery. Place frequently used objects within reach at waist and shoulder level. Cook and freeze meals in advance so that you have ready-made meals handy. Consider modifying your bathroom to include a shower chair, safety bars, stair railings, or raised toilet seat, especially if receiving a hip replacement. Make sure to arrange that a family member, friend, or caretaker will be available for 1 to 2 weeks after surgery to help with activities of daily living, such as pet care, cooking, laundry, housework, and shopping. You will not be able to drive until 4 to 6 weeks into your recovery, so taking the time to make preparations before your surgery is very important.
Getting ready for your surgery starts the night before. You will receive a preoperative total joint replacement booklet with instructions and a checklist. Please follow the checklist to help with preparation and to reduce stress. There are certain medications you will be allowed to take. Refer to the list in your booklet. If you have any questions, ask your surgical team. Cleveland Clinic will call you the night before your surgery. You will receive information on when and where to arrive in the morning. Please give yourself extra time. It is always better to arrive early than late. It is also critical that you inform your surgeon or surgical team if anything has changed about your health status before your surgery, such as current or recent infections, dental, urinary, or gastrointestinal, as well as any cuts, scrapes, or injuries to the operative leg. Any of these can increase your risk of infection after surgery. Some may require preoperative antibiotics, while others may require delaying surgery to protect you from having a poor outcome. There is some tasks to complete before bed. It is important to take a shower the night before surgery. You will also receive special wipes and instructions on how to use them. These help to cleanse some of the normal bacteria that lives on our skin, which will help decrease your risk of wound healing difficulty or infection. After setting an alarm to allow plenty of time in the morning, make sure to get a good night's sleep. Based on your preoperative phone call, you will arrive at the surgical desk to check in. Your surgeon is a part of a large care team, and you will meet many members of this team as they help you get ready for your procedure. Part of your team will be the staff anesthesiologist, and often a certified nurse anesthetist. They work alongside your surgeon to provide you excellent care, and will review your anesthesia plan with you. Many total joint patients will receive some form of preoperative nerve block to help with pain after surgery. For the surgery, many patients receive what is called a spinal anesthetic, which numbs the body from the waist down, combined with sedation. A smaller percentage of patients will have general anesthesia. It is common to have questions about anesthesia. Please feel free to ask any questions or address any concerns you may have. Your surgeon and their team will also frequently meet with you in the pre-op area and can address any questions. While you're still awake, a surgical huddle will be performed either in the pre-op area or right when you come into the operating room. The surgical team reviews a final safety checklist and will confirm and mark the area on your body where the surgery will be performed. Once you're in the operating room, you will notice many caregivers. Your surgeon's team includes the anesthesia providers, OR nurses, surgical scrub techs, and assistants and trainees such as nurse practitioners, physician assistants, residents, and fellows. They are all trained and invested in keeping you safe and providing you excellent care. If a family member or friend comes with you on the day of surgery, they will be escorted to the waiting area and will receive updates from the front desk regarding your surgery. Depending on location, some of the waiting rooms have a status board that provides these updates. A total knee or total hip replacement typically takes between 1 to 3 hours, depending on the level of complexity, plus additional time in recovery. It may be up to 3 to 6 hours before your family member or friend will see you again after your surgery.
Once the surgery is complete, your family members will be updated. This is often in the form of a phone call from the OR team, a phone call from the surgeon, or the surgeon directly meeting with family in the consultation room. Once out of the operating room, you will be transported to the recovery room. Your OR team and recovery room teams will do a safety handoff to provide a seamless continuum of care. Emerging from anesthesia can be somewhat disorienting. Do not be alarmed if it takes some time to feel fully awake. If you have had spinal anesthesia or a nerve block, you may have some numbness when you awake. This will eventually go away. Depending on your surgery, we may take an X-ray in the recovery room. Once fully awake from anesthesia, you will be moved to a room on the hospital's orthopedic floor. Members of your medical and surgical teams will ensure that your needs are met. This often includes residents, fellows, and members of our internal medicine team who assist with your medications after surgery.
1, 2, 3.
Getting up and moving soon after your surgery is an essential part of the recovery process. You will work with the physical therapy and occupational therapy teams to ensure that you are able to walk safely, you understand post-operative restrictions, if there are any, you can perform home exercises, and you can safely make the transition home. Your therapy team will help you work on essential homegoing tasks, such as navigating stairs, grooming, and dressing. If you have had a total hip, total knee, or a revision total joint procedure, you may have specific precautions to follow. These will be reviewed by your therapy team. The case management team will work closely with you, your family, the surgeon, and the therapy team to determine your discharge needs. This may include home therapy, outpatient therapy, home health care, or specific medical items for your home. They will also work with you to determine the best time of discharge, which for the majority of first-time total joint replacement patients will either be later the day of the surgery or the following day. In the rare circumstance where discharge to a rehabilitation facility is required, the case management team will work alongside both the patient and their insurance company to determine the best location. Homegoing medications will also be reviewed. These include antibiotics if needed, and medications to help with pain, inflammation, and blood clot prevention. Once you have met all of your milestones with therapy and your pain is well controlled, you will be discharged. We will make sure your paperwork has all of your post-operative instructions, as well as your follow-up appointments with your surgical team.
The first couple of days after surgery, you should take it easy. Performing your home exercises according to your therapy sheet is very important. Your bandage will remain in place for 7 to 10 days. Keeping the surgical site clean and dry is very important. Continue to make sure that your living space is clear of items that could cause you to fall or trip. You will have a list of medications to begin, continue, and discontinue after surgery. You will likely be on pain medication, a blood thinning medication, and in some cases, an antibiotic. While the blood thinner and antibiotic will have a specific duration, it is important to wean yourself off the narcotic pain medication as your pain subsides. After your total joint replacement, we expect you to be able to gradually return to your normal activities. Eating a healthy diet and staying hydrated are important to your recovery. In many cases, home health care or home physical therapy will be arranged prior to discharge from the hospital. These team members will come to the house. They will help you with mobilization, exercises, and post-operative care. They will also review red flag warning signs of complications, which, although very rare, are important to understand. These include acute increasing pain, new drainage, fever or chills, shortness of breath, and chest pain. Depending on your surgeon's protocol, you will see the surgical team between 2 and 4 weeks after your surgery. At this appointment, you will often get x-rays, have your progress and range of motion assessed, and have your surgical site examined. Your surgical team will review the next steps in recovery, including any updated precautions, exercises, and activities. At this point, you are still not fully recovered. Aches and pains, some swelling and bruising, difficulty sleeping, as well as lower levels of energy are all normal. After your first post-op appointment, you will continue to experience an increase in function and activity. We expect that you will begin resuming more normal out-of-house activities. Easing into these activities is important so that you don't get injured or have a setback. If you are still working, it is likely that you will begin returning to work at this time, depending on the physical demands of your employment. You will have a second post-op appointment with your surgical team, often between 6 and 12 weeks. In many cases, you will be driving and functioning independently at this point. Your surgeon will review your progress, check your surgical site, and may possibly get another set of x-rays. They will review expectations moving forward. If you are progressing appropriately, this will often be your final early post-op visit, followed by annual exams. Once you have been cleared by your surgeon to return to all activities, enter these with ease. Let your surgeon know if you develop any sudden changes in symptoms, including new swelling, new pain, fever, chills, or drainage. If you develop any infections elsewhere in your body, it is critical that they be treated promptly with antibiotics to help prevent spread to the total joint replacement. If you have any falls or trauma resulting in worsening pain at the total joint, notify your surgical team immediately. It is possible you may need a repeat exam and x-rays. Remember, at Cleveland Clinic, it is our goal to help you get back to your daily life safely and without pain. Your orthopedic and total joint replacement teams are here for you, before, during, and after your surgery. If you have any questions, please use MyChart messaging.